In our modern world, there is immense pressure to perform. This pressure extends into the most private aspects of our lives, including the bedroom. Many people, particularly men, feel a significant weight of expectation when it comes to sexual performance. This can stem from cultural portrayals, personal anxieties, or the simple natural changes that come with aging. When intimacy does not meet these expectations, it can trigger feelings of inadequacy, stress, and a strain on relationships. This personal, often unspoken struggle drives many to seek a quick fix, a simple pill that promises to restore confidence and vitality. This quest is not just about physical function, it is tied to psychological well-being and self-worth. When erectile dysfunction or decreased stamina arise, anxiety can become the cause of the problem. Pills seem to offer a discreet way to break the cycle. When people talk about bedroom pills, they usually mean two very different categories. First, prescription medications. Second, herbal or over-the-counter supplements, sildenafil, tadalafil, vardenafil, PDE5 inhibitors. They increase blood flow to help achieve and maintain an erection with sexual stimulation. These drugs are rigorously tested for effectiveness and side effects and require a doctor's prescription. Herbal supplements are marketed as natural alternatives, widely available in stores and online. Ginseng, ginkgo biloba, horny goatweed, yohimbine, bold claims, little evidence. Unlike prescriptions, these are not regulated the same way by the FDA. Safety, effectiveness, and purity are not guaranteed. Doctors screen for heart disease, blood pressure, and interactions, a crucial safety net you lose with self-medication. Using any performance-enhancing pill without a doctor is like navigating a minefield blindfolded. Even FDA-approved drugs have side effects. Headaches, facial flushing, nasal congestion, indigestion. More serious effects can occur, vision or hearing changes. Priapism, a painful erection, lasting more than 4 hours, needs immediate care to prevent damage. Risks escalate with unregulated pills bought online or over the counter. You do not know what is inside them. Many are tainted with undisclosed drugs such as sildenafil or tadalafil, often in dangerous amounts. Dosages can far exceed recommended limits, amplifying side effects and cardiovascular risk, heart attack, stroke. Contaminants can include heavy metals, pesticides, or different drug classes, with no quality control or accountability. Unknown ingredients can trigger allergies, harm your liver or kidneys, and interact dangerously with other medications. ED can signal heart disease, diabetes, high blood pressure, or hormonal imbalance. Masking it with a pill misses early diagnosis that could prevent life-threatening consequences. A medical evaluation is not just a prescription, it is a comprehensive health check in context of your whole well-being. The dangers of unregulated bedroom pills are backed by sobering data. The FDA's database of tainted sexual enhancement products keeps growing. For over a decade, hundreds of public warnings have been issued. One FDA analysis found nearly 80% contained undisclosed active pharmaceuticals. Fraud is widespread. The pill you buy online is likely not what it claims. The problem is global. A 2021 WHO report flagged sexual enhancement drugs as among the most counterfeited. Illegal operations use unsanitary conditions and inaccurate dosing. Studies of counterfeit Viagra found doses from 30% to over 150% of labeled strength. Imagine thinking it is standard but it is 1.5 times the max safe amount. Every unregulated purchase is a gamble. Case reports document heart attacks, strokes, and severe blood pressure drops after over-the-counter pills. A healthy young man suffered a heart attack after a herbal supplement spiked with high-dose tadalafil. And these are real people harmed by deceptively formulated products. The difference between a doctor's care and buying from an unverified source is responsible healthcare versus a reckless gamble. With a physician, it starts with a conversation, evaluation, medical history, lifestyle, and tests when needed. The goal is to uncover whether it is blood flow, hormones, nerve issues, or psychological factors. Prescriptions are the right drug at the right dose, made under strict quality controls. Doctors and pharmacists prevent dangerous interactions. For example, PDE5 inhibitors plus nitrates can be fatal. Buying online or at a counter offers no evaluation, no history, no professional warnings, no safety net. You could get a sugar pill, a dangerous overdose, or a contaminated product. A doctor offers a pathway to lasting health, treating diabetes, heart disease, stress, or anxiety if those are the root causes. Choosing medical care is an investment in long-term health, not a risky mask for symptoms. If you have concerns about performance, the most important first step is to talk to a doctor. Feeling embarrassed is normal. Doctors handle this with sensitivity and professionalism. Start simply, I have concerns about my sexual health. Your health is the priority. A confidential medical discussion is the only safe way to explore options. Beyond pills, regular exercise improves blood flow. Eat a balanced diet, limit alcohol, quit smoking, and get enough sleep. Focus on connection, communication, stress management, and mindfulness.